New figures from Public Health England have shown that coronavirus cases in the northeast have doubled in the past week. COVID-19 infection rates were relatively low across the region, but all authority areas have recorded an increase with cases, more than doubling in the week leading to the 14th of August. Newcastle, Sunderland and Middlesbrough are some of the worst hit areas in the region. The North East chairman of the British Medical Association, Dr. George Ray, has given his advice on the growing infection rates.
I think as far as a doctor's view is concerned, it's not at all inconceivable that we have returned to the new norm a bit too quickly. The virus is still about, and indeed if you look at the figures over the last couple of days or so, the virus is starting to increase. And when I speak to my public health doctors, the colleagues that I have, they're saying, well, really, the infection rate should have been much lower before we actually started to do the things we're actually doing at the present time. So I think if you wanted a medical view, and it would be my medical view, the actual infection rate is still high, and we're now going to do things which bring us potentially closer together. We've not got to forget about the social distancing. We've not got to forget the fact we're coming into autumn. Winter isn't a million miles away, and the virus still can spread. So all in all, the virus infection rate is rising. We're doing things we weren't doing before. We really have not got to be complacent. We really have not got to drop the guard, because if we do, it'll be a perfect scenario in brewing for the virus to actually pass from one person to another. The bottom line is this: please don't be complacent. Please don't drop your guard. Please realise the virus is still about, and please do all that you can to mitigate the virus spreading from one individual to another.